and I'm going to talk to you about arthritis. So, what is arthritis? Arthritis is basically the inflammation of your joints. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Starting with osteoarthritis, this is the most common form, and this is when the cartilage surrounding the joints is broken down, and this can result in a bone on bone grinding. Some of the symptoms of osteoarthritis are pain, tenderness, stiffness, loss in flexibility, and bone spurs, which are extra bits of bone that can form around the affected joint. Some of the risk factors are age, so old age, sex, in particular, women are more at risk, added stress on the joints, genetics play a role, as well as joint injuries, such as like a sports related injury. Next, we'll talk about rheumatoid arthritis. Rheumatoid is an autoimmune disorder, and it basically mistakenly attacks the synovial membrane that lines your joints. That synovial membrane can become more and more inflamed and swollen over time. This can result in erosion of the bone or joint deformity. Some of the symptoms are tender, warm, and swollen joints, similar to osteoarthritis. Furthermore, it can result in fatigue, fever, or weight loss. And then 40% of those with rheumatoid arthritis will experience effects outside of the joint, such as on their skin, eyes, lungs, etc. Some of the risk factors of rheumatoid arthritis are, again, sex, in that women are more at risk than men, family history, smoking can put you more at risk, and then environmental risk, and that could be if you're breathing in too much asbestos, for example. Then here we have what is a normal joint. There's two bones here and here, and then you have the cartilage that protects the joint, protects the bone from rubbing on each other. So on the sides here, you have the synovial membrane. So at the top right, we have osteoarthritis, and as you can see, the cartilage has been progressively broken down, and that's what can cause, when it's moving or after movement, can cause pain to someone with osteoarthritis. And then rheumatoid arthritis, as you can see, the synovial membrane is swollen and inflamed. That's why it's red. And then you can see some of the bone erosion, as well as you can see it's not straight, so there's a deformity. So what are the nutritional needs? So in both osteoarthritis and rheumatoid arthritis, the needs were pretty similar in that you need a lot of antioxidants, and you can get those through vitamin C, and that aids in cartilage development. So you can get vitamin C, you can get in, that can be like more citrusy type fruits, like pineapple or oranges. You could also get it in vegetables such as broccoli, kale, cauliflower. Vitamin D is also essential. And vitamin D can actually prevent the breakdown of the cartilage, as well as decrease like joint space narrowing. And you can find that in like fortified milk, eggs, yogurt, salmon, other fish. Beta carotene is also an important antioxidant because it destroys the free radicals that can damage your joint. You could find that in like carrots, romaine lettuce, spinach, sweet potatoes, fruits like cantaloupe or apricots. Other important foods for arthritis is omega-3 fatty acids, and what this does is it decreases the inflammation in the body, as well as it can suppress the production of these cytokines and certain enzymes that actually break down cartilage. And you can find those in like fish, like salmon, and then you can also find them in a lot of nuts and seeds, such as like walnuts or flax seeds or chia seeds. And then another, which I was unaware of, are these bioflavonoids. And these are basically some other forms of antioxidants, and they have some anti-inflammatory effects. And it's said to be similar to like taking an aspirin or ibuprofen, in that it's anti-inflammatory in that way. And you can find that in things like kale, broccoli, blueberries, even apples. So, what can we take away from the nutritional needs? Um, we've talked about it this whole semester, and that's just eating a variety, in particular, a variety of fruits and vegetables. So, making sure you get all those colors, all the color vegetables, all the color fruits should lead you on your way to decreasing your risk nutritionally, as well as enjoying some nuts, fish, and some healthy oils that are going to have some anti-inflammatory properties to them. And then here are my sources, and thank you all if you are viewing this.